So today as well, we've had Kim. She was kind enough to volunteer for us and talk about her experience with Radiesse. So if you look at her face, she has a beautiful face, well proportioned, very nice brow position, excellent peak to the brow. She does have really good volume, but she has a little bit of a nasolabial fold right here. So option number one is to fill that, volumize that directly. Option number two is to do more of a diffuse injection and lift it and kind of create a little more of a shelf right here for the face to kind of resuspend. And that's, I think, is the more natural result. And we're going to do that for her today. And again, we're going to use Radiesse. So this is a great product for both men and for women. It's going to be delivered the exact same way, although you're going to see we're going to fan it out. It's going to be a lot thinner as compared to our last candidate. So the first thing you're going to feel is just a little alcohol swab, and I'm just prepping your skin again. So we already treated Kim with some BMT, which is numbing cream, which helps take the edge off of any discomfort you might feel with the injection. You can see she's got great skin tone. You can see how her skin is very nice and elastic. That's kind of one of the reasons why I don't want to volumize this area, because it'll look kind of clumpy. The skin won't expand in the superficial plane the same way that the face will accommodate the deeper plane. And then this here is our needleless cannula. So Kim, we're going to poke one little hole, and then you can see there's no needle on this. And this is going to help cut down on our bruising for you. Good. All right, so I'm going to tilt your head just a little bit that way. Perfect. So then we're going to access this small hole that we created. There it is. And there's a little pressure here as we get through the deeper dermis. So I'm in the deeper plane here. You can see, you can't see the needle tip. And we're just going to lightly and very moderately fan out this entire area. So Kim here is actually a fitness model as well, so she does have kind of weight fluctuations. Not that she ever gets big, but she just gets super cut and small. So we want to, instead of directly volumizing one area, we want to make the entire malar region or mid-face region just a little more full. Good. Okay. Go ahead and look at me for a second. Perfect. Okay. So if you don't mind sitting up for us for one moment so we can see kind of the difference, and if you'll grab a mirror, Laura. So you can see we volumized this area here. If you want to take a look. Yeah. And we used about 2/3 of a cc on that side. So I think we're going to do the same on the other side.
Nice.
Good. So we've finished one side here, and we've got a really nice lift, and we've accentuated the mid-face. We're going to do this side here to achieve symmetry and to absolutely perfect our result. So you can see on the other side, there's no significant bruising or anything along those lines. A lot of that is knowledge of anatomy, technique, but a lot of it actually has to also go to this needleless cannula. You're going to feel a little pinch, stick. Nice job. Good. And so this is our quote-unquote pilot hole through which we use our needleless cannula. Good. And then I like to do this with magnification on just because I think it gives me much more information. So these glasses are actually 3.5 times magnification. Let me see this little small hole we've made. There we go. And there's usually perfect. A little pressure just to get through the deep dermis. Now just because I'm right-handed, I'm going to be a little bit on top of the facial plane here. We're going to fan this out. In more of a wider kind of a plain fashion, because she's got great volume really good volume already. We just want to create more of a lift effect, per se. I've found better success by making that a little more of a diffuse injection plane than just to have it be in a singular area. Good. Over. So every athletic face has almost a triangle. We call it a triangle of youth, how there's a certain fullness to the mid-face, and then as you get into the lower face, it kind of congeals, and it should come at a projecting point at the chin. And you can see by injecting here, we're going to lift this up. This swelling will be gone by tomorrow, and we have accentuated that triangle. The exception to that would be to fill in this area here, and then all of a sudden you're going to plump up the midface, which is counterintuitive because if you know Kim's actually a fitness pro, and she actually spends most of her time cutting and getting her weight down, and the last thing she really needs to have in her face is having a plumpness that's non-anatomic. So here, this is very anatomic. It accentuates her zygomatic arch. We filled in just a little bit of that triangle area, and we made it nice and symmetric, and it really smooths out her overall face. Thank you again for your time today.